Good evening, everyone. Welcome to today's Cell Talk presentation. Today's presentation will be done by Renuka Prasanna on the topic an explainable machine learning framework for lung cancer hospital length of stay prediction. Before we start with the presentation, let me introduce Renuka. Renuka Prasanna is a BTech CSC graduate from Gudlavelluru Engineering College. She currently holds the position of a software engineer at Renic Life Sciences, where she is dedicated to enhancing their skills in the software field. Renuka is committed to continuous improvement, regularly practicing coding, and honing their app development skills. Her passion for coding is evident in the projects they have successfully completed. With a strong interest in the app development, she is poised to make significant contributions to the tech team. With her introduction, now I request Renuka to start with the presentation.
Thank you, Devaki, for this introduction. And today I'm going to present the PPT paper on an explainable machine learning framework for lung cancer hospital length of stay prediction. The topic which I've selected is new technologies related to lung cancer, and the journal title is Scientific Reports. The impact factor for this research paper is 44.6, and the year it is published is 2022. Coming to this research has impact on lung cancer and chronic obstructive pulmonary disease, COPD, and diabetes. Coming to the introduction, this study aims to develop a machine learning model to predict lung cancer in patients' LOS, that is length of stay, at ICU admission. Lung cancer is a disease where the cells grow in vast number of times, and if it starts from the lungs, it is called lung cancer. The signs and symptoms of this lung cancer doesn't shown in the first stage, where it can be shown in the advanced stage of the lung cancer. The study will address the imbalanced classification problem using class balancing algorithms. This study will also use RFE, which is recursive features elimination, and SHAF to improve the model performance. Coming to the general background, the machine learning algorithms can learn from historical data and make predictions about future events. This makes them well suited for the task of predicting LOS, which is a complex problem that is influenced by a variety of factors. Machine learning algorithms can be used to identify the factors that are most important for predicting LOS. For the length of stay of the lung cancer patients, we use RF and LR. RF is random forest fire, LR is logistic regression models for predicting this model. Coming to the present challenges, this lung cancer is heterogeneous, which is having a different phases, making it hard to predict LOS with a single model. Imbalanced data can make it hard to predict long LOS. For this, we are using class balancing. To reduce the cost and complexity of data can be the challenges. And interpreting complex models can be difficult. So that we are using different methods, that is random forest fire and logistic regression. Coming to the objective of the research, the main objective of the research is to develop a machine learning framework that can be accurately predict LOS for lung cancer patients. The framework will address the challenge of heterogeneity and imbalanced data by using combination of machine learning algorithms and explainable artificial intelligence (XAI) techniques. So this is the objective of the research. And coming to the methodology, as you can see the picture here, if the new admitted patient is admitted in the hospital, that can be taken into the database and it can be forwarded to the step 1, which is lung cancer admissions. After this selection is done, then it will be forwarded to the next step, which is pre-processing, includes features extraction, data cleaning, missing values handling, categorical values, variables, and transformation, discretizing LOS. After this pre-processing technique is completed, then we'll go to the next step, which is the feature selection, that is RFE, recursive feature elimination. By taking all the features and eliminating the features which are not required for our model and taking the feature which is required for the model can be done in this step. After the feature selection is completed, the models will be taken for the preparation of this feature extraction. And in this, we took RF, LR, and XGBoost. RF is random forest fire, LR is logistic regression, XGBoost is extreme great boosting. And after this model selection and feature selection is completed, those features will be sent to the training and testing it in the forms of the iteration, where we can see here the first iteration, second iteration, up to the 10th iteration. Those features will be iterated and removed all the unwanted features in this step. After this step completes, we can go to the next step, that is baseline candidate models, where we can get the RFE accuracy. After getting the RFE accuracy, we'll go to the outer performing model, which is RFE, containing all the best top end features which we have featured in the training and testing step. After taking all the top 10 end features, we'll go to the class balancing methods, where we have oversampling, undersampling, and over-undersampling. Oversampling is nothing but as it increases the number of observations for a particular variable. And undersampling is nothing but as it decreases the number of observations for a particular variable. Over and undersampling are the two techniques in data mining and data analytics, where it creates a new data set with a balanced data set. After class, these balance methods is concluded, then we'll go to the accuracy and the AUC. This accuracy will be sent to AI clinical researcher and clinician oncologist for declaring the winning model and modeling tuning. Through this winning model, we'll calculate the clinical insights. By using those clinical insights, we predict the score of the methodology. So in this methodology, we use 6 steps. Those are setting and data extraction. The study used MIMIC3 data set, which contains data from 53,423 adult patients who stayed in the ICU between 2001 and 2012. The majority of the patients were senior adults, 80%, and followed by adults at 20%. The LOS length of stay distribution was 85.58% for short LOS and 14.42% for long LOS. The population of admitted classes were 65.72% for male and 34.73% for female. Coming to the next point, the data pre-processing and feature selection. Data pre-processing is an essential task in the data mining process. The study performed several steps to process and extract the lung cancer LOS data, including inclusion protocol for lung cancer patient, feature extraction, which is RFE, and missing data handling, which is also an RFE, but in iteration, it removes all the features which are unwanted. Decriticizing the target class, which is length of stay. The study also performed feature selection to identify the most relevant feature for predicting LOS. Coming to the next point is class balancing method. Imbalanced data is a common problem in the binary class predictive task. This occurs when one class has the vast majority of the observation. Ignoring this problem can cause occurs in the minority class. This study, we use 6 class balancing techniques to address this issue. Model selection. This study used 3 machine learning predictive models to access the proposed lung cancer LOS, that is random forest fire, XGBoost, and logistic regression, which I've discussed. The RF model was found to the best performing model, followed by XGBoost and LR. Coming to the model performance and evaluation. The study used a suite of evaluation metrics to evaluate the predictive model's performance, including accuracy, IBA, GMS, precision, sensitivity, FI score, specificity, and AUC. Machine learning predictions, explainability with sharp. Model explainability refers to how a human can understand the model's prediction. This study used sharp values to explain the predictions of the random forest model. Coming to the results, this study used the RF model to predict the LOS of the lung cancer patient. This is the main point. These use 6 class balancing methods to address the imbalanced data problems. The addition oversampling technique performed the best, followed by smooth oversampling. Addition oversampling is nothing but as which selects the major difference in the model. And the smooth oversampling is nothing but as selects all the data and which is neighbor to the data set. The undersampling methods perform poorly. The undersampling methods is nothing but as the decreasing of the observations of a particular variable. The combination of over and undersampling methods performed well. As I discussed before, over and undersampling methods are the techniques in data mining and data analytics where we can create a balanced data sets. As you can see the table here, this is the table of a comparison between class balancing methods using clinical significance research selection and random forest fire model. So in here, you can see the smooth CS, Edison CS, ENN CS, Tom links, and smooth ENN. These are the methods, 6 methods, class balancing, where we are used. The sensitivity, specificity, AUC, IBA, and geometric mean is high in the Edison CS. So as you can see in this table, those are 100%. So by this table, by this analytics, the Edison oversampling technique performed the best, followed by smooth oversampling. Coming to the confusion matrix. This confusion matrix divided into 6 tables, which contains true negative, true positive, false negative, and false positive of a short LOS and a long LOS. As you can see here, lung cancer LOS with Edison, lung cancer LOS with smooth, lung cancer LOS with ENN, and the other. These short LOS and long LOS analytics mentioned in the confusion matrix, by these matrices, they are discussed. The study compared three machine learning algorithms, random forest fire, XGBoost, and logistic regression. This RF model showed the best performance in the both clinical feature selection and RFE, recursive feature elimination. The study found that oversampling technique, Edison, and the combination of over and undersampling techniques, smoke Tomac and smoke ENN, performed the best in predicting the LOS of lung cancer patients. Explanations with class balancing using SHARP. The study used SHARP to explain the predictions of the RF model. SHARP is nothing but as Shapley additive explanations, where we can see it is a tool where we can see the output in a visualization format. The study found that the smooth technique was the best at explaining the predictions of the RF model because the smooth technique takes the neighbors of the data set and explains in a form of random forest model. By using the SHARP ranking in this study, we can judge that sequence of data is more reliably related to the situation of the patients. As you can see here, the smooth average feature, this graph consists of the average features contribution for each class, short LOS and long LOS. Long LOS is class 1 and short LOS is class 0, as you can see the picture. And coming to the conclusion, the RF assembler classifier is a machine learning model that combines multiple decision trees. It can be used not only for classification problems, but regression problems too. It is known as to be robust to overfitting and performs well in a variety of predictive tasks. The oversampling technique is a way to balance the data by creating more samples of minority class. These can help to improve the performance of the RF model by preventing it from overfitting to the majority class. Coming to the impact of the research. These contains 2 types, improved care for lung cancer patients and the reduced healthcare costs. These are the main 2 impacts of this research. Improved care for lung cancer patients. This research can help clinicians to make better decisions about the care of lung cancer patients by predicting their length of stay. These can lead to earlier interventions and treatment, which can improve patient outcomes. Reduced healthcare costs. This research can help to identify patients who are at risk of having a long LOS, so that clinicians can take steps to prevent shorten their stay. This can lead to reduced healthcare cost, both for the individual patient and for the healthcare system as a whole. This concludes my presentation. Thanks for listening very patiently. And if you have any doubts, you can find me at jyoti@theretronics.org. Thank you.
Thank you, Renuka, for the detailed presentation. Now the panel is open for questions. We have question from Nupur. Nupur asks, how do they classify long and short stay, and what are the features?
Yes, the long and short stay is classified according to the ratio, according to the stage of the lung cancer and the patient's emergence. Through this, we'll take these two steps into the random forest model. By this, we'll take the analytics of the confusion matrix. Through that, we'll say the short LOS and long LOS.
Okay. Thank you. Hope the answer is okay for you, Nupur. Now we have one more question from Vijay.
Yes.
Vijay asked that did the study include all the subtypes of lung cancer, or it was only a specific subtype?
This is mentioned only the specific type of the lung cancers, like the abdominal things and the lung cancer, which is in a specific area, not for all the types of lung cancers.
Okay. Thank you.
Yes.
Any other questions? I see there is no questions, no further questions. Thank you, Renuka, for the presentation. The next presentation will be by Numair, and the author is Elamin et al. The topic is poziotinib for patients with HER2 exon 20 mutant non-small cell cancer, results from a phase 2 trial.